Well, you're most welcome to this talk, and a special welcome to Senator Gerard Rennick from Australia. Senator, welcome, and thank you for coming on the programme.
Hi, John. It's great to be here, and thanks for having me back on.
And I know it's the end of a busy working day for you, so we're very grateful. Now, the first question I have, Senator, is that I'm just looking at this excess deaths data from Australia here. And we see that the deaths in Australia started going up in May 2021, got higher in June, July, August, September, October, until in October there were 7,192 deaths. Now, this is in 2021. Now, correct me if I'm wrong here, but the Australia vaccine programme began in the February 2021. And COVID didn't really kick off in Australia until 2022. Two questions here, really. The first is, I expect this excess deaths is front page news on all the newspapers and everyone's clamouring to work out why it is. And the second is, what do we think is causing this? What are the possible range of factors? So first of all, is this making the news? Are the mainstream media all over this story?
No, they're not, and they weren't over the story in 2021. And the reason why I think it's worth looking at 2021 rather than 2022 is because COVID was in the community in 2022, and it's been very easy to conflate the excess deaths with COVID. Now, I do think that some of the excess deaths were due to COVID. However, I don't think that the majority of the excess deaths were due to COVID, and the reason why I say that is when I look at the 2021 data, the excess deaths did start to climb in May. Now, the vaccine program only really started to kick off in late March. So given that the ABS has a bit of a time delay in reporting, and for many people, they don't necessarily die in the first day after a vaccine injury, it may take a number of days or weeks. I think there's a very strong temporal association between the rollout of the COVID vaccine and the increase in deaths in Australia. And what's interesting is that by the end of 2021, we had about an extra 9,000 deaths. So deaths jumped from 162,000 to 171,000. Now, it's worth noting that in 2020, deaths were 2019 deaths were 164,000. So the lockdowns reduced the death rate by about 2,000 in 2020. And then it jumped about 9,000 in 2021. So we can't put the excess deaths down to the lockdowns and delayed doctor reactions and things like that. Maybe a part of the climb in excess deaths, but not all of it. And what's interesting is in that increase of 9,000, that happened from April, May onwards, that it started to spike, and it wasn't in the first 4 months. So if that was extrapolated for the whole year, that would work out at about 12,000 extra deaths, or almost a jump of 10% in that year, despite the fact there was next to no COVID in the community.
Mm-hmm. I mean, we remember that there were small outbreaks in Victoria, but there was lockdowns and they were closed down. So there was essentially no COVID in 2021 in Australia.
That's right.
I've just got got the figures, Senator, in front of me here. It's 10,392 excess deaths in Australia in 2021. And bear in mind, this is a population of what, 26.5 million?
Yeah, about 25.5 million in 2021.
Yeah. Why is it that... I mean, imagine 10,000 people had been killed in a terrorist attack. This would be like massive news around the world. Why isn't this being reported in Australia?
Well, I mean, that's the $64 million question, John. And, I can only speculate as to the answer why, but I suspect it doesn't suit the government or the media or the health authorities in the private sector, big pharma and things like that, to actually investigate further, because I can't see that there's any other reason other than the rollout of the COVID vaccines. Now, I'm not saying it's responsible for every excess death. I do think that, the lockdowns may have had some response to it. In 2021, there were about 1,300 deaths from COVID. In 2020, there were about 980. So COVID deaths did increase by about 300, but yet again, a long way short of the extra 10,000 in excess deaths. And what's also very interesting about these numbers is that the largest increase in the death rate was in Western Australia and Queensland, the two states where there were no lockdowns and there was no COVID or very few cases of COVID. And if they were there, they were in people in quarantine. So yet again, the data would indicate that it was a result of the vaccine rollout rather than COVID itself.
I think all of Australia, but as you say, Queensland and Western Australia are a particularly useful model because, as you say, there was no COVID in that time period. So the cause of deaths must be something other than COVID infection per se.
That's exactly right. And we've got two strong indicators there. One is obviously the temporal association between the rollout and the jump in excess deaths and the geographic location of the excess deaths. And I should add a third one as well, was the large increase, and this is something you touched on in a recent video, in adverse events. And not just adverse events, but the rate of adverse events. So as you properly touched on in one of your recent programs last week, was that the death rate, the injury rate, from the vaccine rollout in Western Australia was 264 injuries per 100,000 doses versus a normal rollout, I think, of 11.1. So a jump of 24 or 2,400%, which was huge. And one thing you didn't touch on, and I will touch on this now, is in page 11 in that vaccine injury report. 47% of those people who reported a vaccine injury actually went to emergency, and 48% I think it was, and another 9% were actually admitted to hospital overnight. So all up, 57% of people went to hospital as a result of their vaccine injury. Now, I'm pretty sure I can speak for a lot of Australians. We generally won't go to hospital for something that we consider mild, and we'll only go to hospital if we feel like it's an emergency.
Yeah. So the report this is the report here that we're talking about. It's the official report from the Western Australian authorities, and it is a very detailed report. Now, of the adverse events reported following immunisation that took place in Western Australia, what percentage of those overall adverse events that occurred would you imagine actually got through into the report? Are people good at reporting in Australia? Because in the UK, it's actually quite a low percentage.
Well, yet again, that's something that we don't know of. I suspect it's a very low percentage, but I can't be sure. I can only speculate. Now, I have a friend who's a cardiologist here in Queensland. He submitted 3 myocarditis reports to Queensland Health, and they sent them back to him saying the patients must go back to their GP and get the GP to lodge the myocarditis reports on behalf of the patient, not the cardiologist. So that would indicate that the Queensland Health Department, at the very least, were doing their best to downplay or not report vaccine injuries. And I've had a number of anecdotal stories whereby people who had a vaccine injury, when they, when they either went to the hospital or saw their GP, that they were told verbally that their injury was caused by the vaccine, yet they would not write it down, nor the doctor at the GP clinic, nor the nurse or whoever it was at the registration desk would write down it's a vaccine injury. And in many cases, they wouldn't necessarily hand out the injury report from the hospital. The hospital wouldn't hand that over to the particular patient. So it would be underreported at the very least.
So the culture in healthcare in Australia really was not to report vaccine injuries, it's almost like there was pressure not to report vaccine injuries. Am I going too far to say there was pressure not to report them?
No, I don't think you are with the COVID vaccines. I can't talk to other vaccines and the history of other vaccines. I suspect, like all things, other people have probably had vaccine injuries in the past and didn't report them. And I can't, I can't comment on that. But I've had, a large number of people that I've spoken to, and I've spoken to a lot of people over the last 18 months, say that, their injury wasn't written down as a vaccine injury. I've also had a Queensland Health employee come to me and say that she was sacked effectively because she was told by a doctor to take off the fact that a 38-year-old pregnant woman died a day after receiving the vaccine. And she was told, she was a administrator clerk, who kept the record of all the details, and she was told to remove the fact that she was vaccinated from her record. And she's had to move interstate. So there's some of the stories that I've been told throughout this period, which is just disgusting. And I've also been contacted.
Yes, I mean, we talk about these numbers, but when you get to the individuals at the end of the day like that, it really does have an impact.
Oh, absolutely. And that's unfortunately the least of it, because many people who've been injured have had their injuries gaslighted and they haven't been able to get proper medical support, number one. And number two, they haven't been able to get financial support for their loss of income because they can't work, which I think is even more dreadful, which of course then leads to the mental health issues of being unsure how you're going to pay your mortgage off. I've spoken to a number of people that have not been able to go back to their jobs as a result of their injury. And I've actually had 432 people contact me as a result of a post I put up on Facebook asking for people who were sacked as a result of not taking a second shot after being injured by their first one. And 432 people contacted me. So, it's not just people who've been injured who've been gaslighted and bullied. It's people who don't want a second take a vaccine at all, regardless of their status. And I thought we lived in a free, pluralistic society here where free will meant we counted for something, but clearly it doesn't.
Yeah, and this is presumably just in your constituency area in Queensland. This is a small segment of Australia.
Well, it's Queensland and Australia. I'm contacted by people across Australia, obviously because I'm in federal parliament, and I'm not going to sort of try and not help people from other states just because I only deal with people in Queensland. But no, so I have been contacted by people across the country. Yeah.
Right. Yeah, slightly different system to the UK. In Western Australia in 2020, there was just over 2 million doses of what we might call traditional pre-COVID vaccines given to the population as a whole. And out of this over 2 million doses of traditional vaccines, there were 270 reports of adverse reactions. So that's 270 out of over 2 million.
Yeah.
Now, there was just under 4,000 COVID vaccines given in 2021, so roughly twice as many COVID vaccines as traditional vaccines the year before.
Yeah, 4 million.
And there were it was 9.3 million, so just under 4 million. And there was 10,726. So if it had been proportional, we would have expected about 550 adverse reactions from the COVID vaccines.
Yeah.
We actually got nearly 11,000, which was 97% of the reports following COVID vaccines. What do you think this tells us about the frequency of adverse events following COVID vaccines compared to traditional vaccines?
Well, it tells us that the COVID vaccines are causing a lot more injuries than a traditional vaccine. Step one. And step two, we had about 10 million cases of COVID in Australia by September 2022, 9 months after we opened up the international borders and the state borders, which was almost half the vaccinated population. Now, I've never had mumps, measles, or rubella, like any of the childhood vaccinations you get. Not many people catch that particular disease afterwards, and yet here we are with people who've been given 2 shots at the least, if not boosters, multiple shots, catching COVID on at least once, if not twice. So not only has it got a higher injury rate, it seems to not have worked at all in the first place, which was to stop. The whole point of a preemptive or a prophylactic is to preempt, and prevent the disease. And the whole definition of the vaccine's been changed.
Yeah, absolutely. So the precise data we've got here is from Western Australia. I mean, are we being unreasonable to extrapolate this into the whole population of Australia, or do you think this is fairly representative of Australia as a whole?
Well, it's all we've got to work with. And Western Australia represents about 10% of the population, so it's a large sample. And it's very significant because Western Australia was the last state to open up its borders to the rest of the world. So 2021 was a clean year. It'll be interesting to see the 2022 data once we include the boosters, because I know a lot of people got the first 2 shots and came out of it okay, but it was the boosters that actually caused the injury. So it would be interesting to see how many injuries are going to be reported in 2022. And I have to commend the Western Australian government for actually releasing that report, because many other state governments didn't. The only other data that I am aware of is in regards to cardiac presentations at emergency. And that's been collected by a few different people that have contacted me. So I've got data there for South Australia, Victoria and Queensland. And cardiac presentations for younger people skyrocketed in April, November 2021 in all of those 3 states. Now, 2 of those states, South Australia and Queensland, didn't have COVID at that time. And Victoria had some COVID around that August period, but not later in the year, or much less later in the year. So that's also a very strong signal that would indicate that the vaccine was causing heart complications, or myocarditis, pericarditis, to be more specific.
Australia is actually this natural experiment, isn't it? Just waiting for people to start analysing this and getting to some conclusions. Now, this Western Australian report here, it was 6 months late, but I was actually impressed by the candour in the report. It does seem pretty straight talking. Why haven't the other states produced something similar?
That's a good question, John, and I can only speculate again because I'm not, involved with the health departments in those states. But it doesn't suit them to release the data. Is the only reason I can think of. I mean, it is now midway through 2023, and I don't see why it takes up to 18 months. Up to 18 months to release that data.
Yeah. So the total report of adverse events following COVID vaccines was 264 per 100,000 doses for the traditional vaccines in Western Australia, where we have this precise data. So during the same 2021 timeframe, there were 11.1 events per 100,000 doses, whereas with the COVID vaccines, as we've said, it was over 10,000 doses, over 10,000 adverse reactions. Why didn't this come up as a red flag at the time? Why didn't the authorities surely the authorities should have been monitoring this in live time and said, just a minute, there's a problem here. Why didn't that happen?
Because they didn't want to stop the rollout. And I can speak personally to that because I went to see the health minister at the time, Greg Hunt. I advised him of I was contacted by a large number of constituents, in particular young constituents who had serious side effects from the vaccine. And I'm talking paralysis, clots, strokes, tremors.
I've got a long list, Senator. Anaphylaxis, thrombosis with thrombocytopenia, immune thrombocytopenic purpura, Guillain-Barré, myocarditis, chest pain, deep venous thrombosis. We could go on. There was a long list in this report. And again, just alarming to me that didn't come up as a red flag.
Exactly, especially when it was in young, healthy people who had no prior existing conditions and very shortly afterwards then had serious adverse events. Now, maybe they weren't all caused by the vaccine, but there was enough high enough injury rate to be a red flag to the TGA. They should have acted on it, and they didn't. The health minister at the time, Greg Hunt, should have pressed the TGA. He should have picked up the phone to them and said, I've got a senator here who says he's been contacted by a large number of constituents. You said this vaccine was safe and effective. We've got state governments forcing people to take these jabs or they lose their job. Is it safe, effective, and effective, yes or no? And can you get to the bottom of why these injuries are occurring? And the head of the TGA at the time, John Skerritt, pretty much gaslighted and dismissed most of the injuries. He kept saying, well, we've got to look at the background rate. So here's the irony. He was saying, well, people get these type of injuries every day, and yes, they probably do. And he kept saying, well, we've got to look at the background rates. Well, we've now got the background rates, or at least from Western Australia, and they would indicate that the COVID vaccine had a much higher injury rate than other vaccines. And the question needs to be asked, as you said, why didn't the TGA monitor this data in real time, and why wasn't it corresponding with the state governments to get this data out quicker? And effectively stop the rollout, as far as I'm concerned, at the very least for younger people, younger, healthy people of working age population who had very low risk from COVID. I'm not saying that there was no risk, but that never happened. And the argument they will put forward is that the risk from the COVID is still worse than the risk from the vaccine. I dispute that, and that's for the reasons we discussed in our prior interview, whereby they did codon optimization, extended the poly-A tail, introduced transfection, et cetera, into the vaccine, which in my view increased the risk of the vaccine greatly, especially since a lot of this stuff hadn't been tested in humans on a longitudinal basis. So, so yet again, the benefit of the doubt for that very reason as well, the fact that testing hadn't been thorough, they should have pulled up stumps the moment they saw such a high injury rate.
Yep. Now, I assume the COVID vaccination program's essentially stopped now in Australia. Is it just high-risk groups that are currently getting vaccinated, or?
It is high-risk groups. So they no longer recommend the vaccine. I need to be careful about this. I don't think they recommend the vaccine for people under 60. They do for people over 60, but they still encourage it. I think it's fair to say they encourage you still get your shots. And they're now pushing the influenza vaccines, very hard as well. And I don't know, they're not mRNA vaccines. My understanding is they're not mRNA vaccines. I don't know enough about the safety of the current influenza vaccines being used.
There are the traditional type of antigen vaccines. It's a completely different category of vaccine.
Yeah, I mean, look, my only word of caution in regards to that, though, is you don't want to over vaccinate people for reasons I know that Robert Clancy's touched on in the past, is that, you know, you can get immune imprinting or original antigenic sin whereby, you know, you'll get your antibodies will respond to the prior infection and not the current infection. So that may still be a risk, I think, even with non-mRNA vaccines if you over-vaccinate. But I don't know enough to know, like, maybe one shot a year is enough. But if you were going to get 3 shots in 1 year, do you start risking, you know, having an immune reaction to prior variants rather than the existing variant?
Which is a good question for the immunologist rather than the big pharma salesman, I would have thought.
Yeah.
Now, given that all we know now about the mRNA vaccines, how concerned are you about the huge new factory that's been built in Australia to develop 100 million doses of mRNA vaccines a year in Melbourne? Is it? I think it's Melbourne.
Well, I'm incredibly concerned about that, because that will become a hammer looking for a nail, because, you know, once these vaccines are produced, they've got to go into people's arms or the money gets wasted. So there will be a lot of marketing and lobbying pressure put on the government by Big Pharma, who've invested all this money to justify the cost and get a return on their investment for their shareholders. So that concerns me greatly. But of course, the other thing that also concerns me greatly is that a lot of people want to move on and just forget about COVID. And not just the vaccines, but the whole reaction to COVID, right from the initial lockdowns, the lockups, the lockouts, the daily press conferences, the misinformation, the bullying, the cruel and inhumane methods used by governments, by media, etc., etc. And this is even before we got to the vaccine rollout. And then, of course, we had the vaccine rollout, which was multiplied again, whereby people were forced to take a vaccine that hadn't been thoroughly tested. That was a blanket mandate. So, for example, you know, I've got a son who's allergic to penicillin. I've got another son who's allergic to pecans and walnuts. And I've got a daughter who's allergic to nickel. Now, you know, just because my son's allergic to penicillin doesn't make me an anti-penicilliner. But, you know, for my son, he can't take penicillin. So if there was some sort of a program where everyone had to take penicillin, that would obviously be a great concern to me. And I'll note that I'll stand to be corrected on this, at least one, if not 2 of the 14 recognised deaths by the TGA, 2 of those people had antiphospholipid syndromes. Now, we know that phospholipid is one of the lipids used in the vaccine, yet the TGA still will not put a warning label on the COVID vaccine to say that if you've got an antiphospholipid syndrome, you may want to think about actually taking this particular vaccine because there's phospholipids in the vaccine. So, you know, it's this whole ignoring the risk. That is you don't need to be a neurosurgeon to work that out. I mean, that is really basic medicine. You don't give allergy-inducing components to people that are sensitive to those allergens. It's just absolutely, and it's this failure to recognise the risk in all of these things. And people try to put me into an anti-vaxxer camp, or put people into anti-vax, pro-vax camps. That's not the question people should be asking. The question is, are your politicians, especially senators, which the Senate's a House of Review, are we asking the right questions in regards to risk and the reward benefit? And is proper quality assurance being taken in regards to the decision-making process? In my view, in regards to COVID and many other things, mind you, but we won't go there tonight, but climate change might be one of them, is the proper empirical method of testing, getting repeatable observations, and then applying skepticism, one of the major schools of epistemology, to that process is not taking place, because we have a media that pushes out propaganda, and then anyone that tries to refute the propaganda or ask legitimate questions are being censored heavily. And it seems to have accelerated greatly in the last decade. I mean, it wasn't that long ago that you could discuss, different points of view without getting labelled, an anti-vaxxer or cooker or whatever.
Yeah.
But today, unfortunately, free will and free thought just seem to be completely shut down or being shut.
It's science by people with BAs in journalism, isn't it? It's just quite incredible.
Yeah, it is.
Yeah, in 2021, there were 1,125 appointments made at the Adult Vaccine Safety Clinic at the Sir Charles Gardner Hospital in Western Australia. So 2021, 1,125 appointments made. In 2020, there was 7.
Yeah.
Again, I mean, I don't think there's any need to comment on that, but why wasn't this seen as a red flag? It's just incredible.
Well, look, I know one of those people who went to that clinic, Chantel Run, and she was a Western Australian police officer in Western Australia, a 30-year-old fit and healthy female. And I don't think she'll mind me mentioning her name tonight. She was told, so she was one of the first people who contacted me with her vaccine injury, and it was the response of the medical community to her injury that sent off my alarm bells. But she got the Pfizer vaccine, was immediately ill, went to see the doctor on and off for 2 weeks saying something wasn't right, ended up having a stroke, had Bell's palsy, the side of her face was crooked, and then she had to go back to hospital later on, have a serious operation on her stomach, I think it was, and was on a potassium drip. She got sent off to the vaccine safety clinic after these injuries, expecting someone to give her counselling and some medical support on how to recover from her injury. And she was actually pressured into taking a second shot. So she walked out. She actually walked out of that injury clinic. And that wasn't the only story I heard like that, where they, even after the first injury, they were pressured to take a second injury. But the thing is, I remember Chantel telling me that she wasn't the only one. They were trying to do the same to about 3 other women who were also in a clinic at the same time in trying to get to take the second shot. And so this sort of behaviour is just cruel and unnecessary. So not only was there no red flag raised about their number of serious injuries, they were willfully ignoring it and trying to continue to, in my view, continue to injure these people that were injured from the first one. It just completely defies logic.
It's almost as if they're being pressurised by their managers, isn't it, to do this? It's
almost they had to be. It was coming from right up top. And this is why I say we need a Royal Commission, and I think we do, but I'll be honest, I'm sceptic that the Royal Commission won't whitewash a lot of this stuff, or the terms of reference will be so narrow that these sort of issues aren't raised. But the other alternative is to have a Senate inquiry, and of course Labor and the Greens voted against that. The current government voted against having that last year when myself and Alex Antic tried to get it moved to have a Senate inquiry. And of course the reason for that is that there's people like myself and Senator Alex Antic and Matt Canavan who would ask the hard questions that would embarrass, not just the current Labor government, but also ourselves.
Mm-hmm. I want to just read you a direct quote from this report here, from the Western Australian report. Adverse events of special interest were monitored by the department during the COVID-19 vaccination programme. So adverse events of special interest were monitored. And they mention under those adverse events that were being specially monitored during the rollout: anaphylaxis, thrombosis with thrombocytopenic syndrome, immune thrombocytopenia, and a few others: Guillain-Barré, myocarditis, pericarditis, myocarditis. Now, given that they knew to specially monitor these in 2021, does that not mean that they knew that these were a problem in 2021?
Yet again, I mean, they were ignoring the very evidence in front of their eyes.
Yeah.
There's no other word for it. It's just blatant and reckless negligence, at the very least. I mean, I could possibly say a few more other things, but I won't. But the evidence was right there, and as I said,
what struck me. They knew to look out for these side effects. So they're probably on there ticking them off, saying when they occurred, rather than saying, just a minute, let's stop these side effects from occurring in the first place. Yeah.
I can't answer why, John, other than the fact that there must have been a lot of coercion from above to not look at, not deal and acknowledge these injuries.
Yeah. Senator, it's the end of a working day. Thank you so much for your time. I have one final question, if you don't mind.
Sure.
You've been questioning this whole COVID narrative and the vaccine narrative. Has there been any adverse effects on you and your political career from the heroic stance that you've taken?
Oh, well, look, I lost my pre-selection about 9 days ago, so I won't be running again in Parliament. Well, I could leave the party and run as an independent. I don't really want to do that because I don't think that running as an independent, I don't want to, in politics, the brutal fact of politics is it's a numbers game, and I'd rather be in a party that can eventually govern so I can influence the outcomes and be a part of the solution rather than sit on the sidelines and complain from the sidelines. Now, there's an important role, I think, for crossbenchers and the Senate to apply a skeptic role. But, I got into politics originally because, I've got major issues with our tax act and our monetary policy that favours offshore profits going offshore. And it's the same in the UK, by the way. I know some of the tax structures in Guernsey and Jersey, and, your weak tears of blood.
Tax is just for little people.
Yeah, you'd weep tears of blood if you knew
people
some of the great,
tax.
My good friends in Britain were being ripped off as well. But look, I want to be a part of the solution. Unfortunately, I took this stand, and I think it has worked against me. But I have to live with myself. I know I did the right thing by the people and our party values. Unfortunately, some people use that against me to say that somehow I was disloyal to the party. I completely disagree with that. I thought I was loyal to the people. I think, and ultimately, party is a means to an end, which is to protect the people. I'm an unashamed protectionist. I hate neoliberalism. Look, all I can do is try my hardest, which I did. And hopefully, I've still got 2 years to go, and hopefully we can, try and get some justice for those who've suffered a great deal of harm as a result of the injuries and the mandates.
And I know your stance has commanded a lot of respect and gratitude from Australia and people around the world. I'm getting feedback from around the world. People are grateful. So, Senator, we've taken quite enough of your evening. I hope you can get home and have some tea now. Thank you for your time, and thank you for your insights, and thank you for your self-sacrifice that you've done for this. It's appreciated by people around the world.
Thanks very much, John. Look, I never lost my job or got injured throughout all of this period, and so I've been very lucky. It's those people who've been injured and lost their health and lost their income that have really suffered. My loss is very small compared to theirs. But thanks very much for your support. I really appreciate that. And I look forward to keeping in touch with you and your listeners.
Yeah, thank you, Senator. We appreciate it.
Thanks, John. Have a great night. Great morning.
Yeah, it's morning for us.
Cheers, mate.